Hello everyone, I am Lakshmi Priya Nair and I welcome each one of you to Express Healthcare series on Indian Stents Get Updated. Today we have Dr. Subhashish Roychuadhury from AMRI Kolkata who will tell us why Indians are more susceptible to cardiovascular diseases and how talent trial can help us take more informed decisions. So thanks a lot Dr. Roychoudhury for joining us here. We are very glad to have you with us. To begin with, can you tell us why Indians are so susceptible to cardiovascular diseases?
Thank you, Lakshmi. I think what we should understand as Indians, as Southeast Asians, we are more predisposed because we have got a genetic predisposition to all these cardiovascular diseases. I think what's much more important for us to understand is that over the period of maybe 4 to 5 decades, healthcare in our country has improved, and therefore the focus has shifted from communicable diseases to non-communicable diseases. So maybe 4-5 decades earlier, we were more concerned about tuberculosis, about cholera at one point of time. We have taken care of these infections. The people living longer, they're living till more age group, and so now we are seeing people of 60s and 70s with surviving till that age and therefore coming up with problems of lifestyle diseases. Add to that our obesity, the food habits that has been changing over the last few decades. But all of them put together makes cardiovascular diseases and metabolic disorders more prevalent, more so in the last perhaps 2 decades or so.
Okay, but we are also seeing a lot of younger patients getting it. So is lack of awareness an issue?
More than lack of awareness, it's the change in lifestyle is the issue. We have become more sedentary. We spend more time in offices. We don't go to normal activity, outdoor activities. And our food habits have changed. Junk foods, more calories than we require. That's, I think, what is contributing more rather than awareness. Awareness is available on the net, on television. We know that we need to run. We know that we need to avoid junk food. It's practicing healthy lifestyle, I think, which is not really working.
Okay. So now that we have such a huge burden of CVDs, have the techniques and technologies for cardiac care that are available in India evolved?
Obviously, we are very advanced in India regarding cardiac care, both in the diagnostic part and the therapeutic part. We have moved on from non-invasive diagnostic techniques to invasive diagnostic techniques like coronary angiography. And once we know that you have a lesion or you're symptomatic with that block in the heart, there are interventions available and easily available, not only in the big cities, but even in the smaller cities where we can do angiographies and angioplasties. So certainly they have evolved.
Okay. Stents, for instance, is a very commonly used technology
Right.
and a device. What have been the progression and the progress that we made in that sphere?
Right. I think it's been a huge leap over the last 10-15 years. There was a time when angioplasty was a procedure which was feared both by the doctors and the patients. Nowadays, angiography and angioplasty, the angioplasty is a procedure where we put in a stent in the coronary artery and remove the block. So angioplasties are routinely done, both as a primary angioplasty procedure as a life-saving measure in a heart attack patient, and to remove in a non-primary case in a patient of chronic stable angina who is having chest pain on walking.
How do you make the choice between a stent? Has trials like the talent trial help you make more informed decisions?
Once we speak of trials, I think there should be a brief statement made before this, is that in this age of plethora of trials going on, much importance is given to the number of patients taking the trial, whether it's a randomized controlled trial or not. And in that sense, talent, I think, has made a huge difference. It's, I think, one of the first trial with such a huge number of patients coming from our subset, which has proven the benefit of the stents. What we are very proud of is that we have been able to contribute to the international literature. So for the first time, we go to international platforms and say that this is our data.
So can you elaborate more on the need for such trials and studies?
We need to know because each patient population is different. What works for an US citizen may not work for the Indian. We are different in body habitus, we are different in what we take, we are different in the size of the vessels, we are different in the size of, in the nature of the atherosclerotic burden. So we need to have a subpopulation study of our population so that we can use that to treat our patients better, rather than accept data from trials which had patients who were not like us.
So doctor, how has these trials helped you in your clinical practice? How have they helped you assure patients that the stents that are made in India are just as good as the ones that are made abroad?
Right. Over the last few years, technologies have improved. The stent manufacturing method has improved, and now having used stents previously also and having used them now, I can feel the difference that stents are better trackable. They come with thinner struts, with lesser amount of complications. They're very easy to use, as good, and in some instances perhaps better than even the foreign made stents. There are two aspects to the whole thing. As operators, we ourselves had been skeptic a decade ago about Indian manufactured stents. We have gained confidence as operators. I'm very comfortable working with Indian stents now. Once the doctor gains confidence, he can impart this to the patient, and the patient will also feel happy with a comfortable doctor and a stent.
Okay, that's really great to know. So tell me, doctor, how will cardiac care evolve in the coming decade? And what will be the technologies and techniques which will make a difference? Will they also be accessible and affordable?
Affordability had always had been an issue with coronary interventions. But yes, with the stent pricing coming down, it's much more affordable nowadays. It's available. People know about it. People ask for the treatment. And with time, what we foresee is that we are going to come up with better technologies, with stents that are thinner, with better medicines, with better drug-eluting stents, giving lesser chances of complications like thrombosis and restenosis rates. What is much more going to evolve in coronary interventions are the delivery systems of the stents. For example, we do phase delivery of the stent to the target area, so we have devices to do those. So there are techniques, there are instruments, there are devices like rotablators, shockwave lithotripsy, and that's the future in coronary interventions.
Okay. So there's going to be a lot in store for cardiac care.
It's exciting
future.
times. It's very exciting times.
So what would be your one message to young cardiologists?
Young cardiologists are coming in at a time into intervention which is really ripe to try out new things. It's no more the days when angioplasties were very rare. There are so many angioplasties going on, which exposes them to a lot of experience. So my message would be to try out newer technologies, have faith on the Indian stents, and to think, individualize every patient according to his or her required care.
So nice of you to join us here. Thank you so much, Dr. Roychoudhury.
Thank you.
That's Dr. Roychoudhury with us, telling us about how cardiac care will evolve and the technologies which will make a difference. Thanks a lot for watching us on Indian Stents Get Updated. Stay tuned for more updates.